Welcome to COVID313 Community Coalition for Families and Students Teletown Hall. I am Christine Bell, a mother of 3 beautiful children, honored to serve as the Executive Director of Urban Neighborhood Initiatives, member of 482 Forward, and co-host for today's Town Hall. As a mother, a daughter of 2 elderly parents, and a leader of an organization, I have spent many hours of the day worried about if I'm making the best decisions to ensure my family, my staff, and our community is safe, healthy, connected, and supported during this really difficult time. I have found comfort in learning as much as I can because I know that knowledge is power. We are so glad you could join us today so that we can learn and become more powerful together. We're going to get started in a few minutes. We are translating the town hall to Spanish, Arabic, and ASL, so we want to give folks time to get on the right line and get comfortable. Cindy, please share the phone number for Spanish translation.
Si necesitas traducción en español, por favor, hable al 313-626-7440. Hoy la señora Gloria Rosas y Liliana Torres harán la traducción.
Thank you, Cindy. Saeed, please share the phone number for Arabic translation.
إذا كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على الرقم 313-241-7030. معكم سعيد ونجوى دحدح ونحن مستعدون لخدمتكم. شكرا.
Thank you, Saeed. Katie, please share the instructions for ASL.
Thank you, Katie, and thank you, Christine. And welcome all of you that may be just joining us. My name is Jametta Lilly, and I am extraordinarily blessed to be a grandmother, a Detroiter, and the CEO of the Detroit Parent Network. We are so delighted that you are continuing to come to us for information, because information and knowledge is power. And as we all know, the people can perish for the lack of knowledge, which is why the coalition is so committed to make sure that we are providing knowledge to you every time that we come, because facts matter. We're here to provide resources for you and to support you, because we know how difficult and challenging this time is for all of us. We're all experiencing this as grandmothers, aunts, uncles, and youth. But again, we know that by working together, by staying focused on information that helps keeps us safe and healthy, that will help us also to overcome the tragedies and even the fears that the COVID virus has created. We know that together we can have power through our knowledge. And with that, please, we are so excited to have more experts to continue to bring us information to keep us powerful. Christine?
Thank you, Jametta. It is indeed a time to stay connected, be informed, and make sure we're as powerful as we possibly can for ourselves and for our family. Soon we'll hear from State Senator Stephanie Chang, Tanya Morris Diaz, Staff Attorney, Michigan Immigrant Rights Center, Dr. Nikolai Vitti, Superintendent of Detroit Public Schools Community District, Ralph Bland, founder and president of New Paradigm for Education, April Hines-Jen, representative of Leona Group and principal of Cesar Chavez Academy Middle School, Crystal Hepburn, team lead, Children's Special Health Care Services, Detroit Health Department, Laura Lefevre, director of Community Projects, Children's Center of Wayne County, Michele Oberho, Director of Tax Foreclosure Prevention at the United Community Housing Coalition, Joe McGuire, Housing Attorney, Detroit Justice Center, Jim Schaffman, Michigan Poverty Law Program Advisory Board, Monica Lewis Patrick, Director of We the People of Detroit. stay with us for the next 90 minutes so you can stay informed, ask questions, and get answers so that you can be as informed as powerful as possible. We really do want to hear from you. So to ask your questions, please use the chat on Facebook or text your questions to 313-288-2082. Again, that number is 313-288-2082. We will have Q&A after each segment. If we can't answer your question today, we are committed to getting the answers to you by early next week. All questions asked today will be posted with answers on onedetroitpbs.org. Cindy, please share the Spanish translation number for folks that have just arrived.
Si necesita traducción en español, por favor hable al 313-626-7440. 313-626-7440.
Thank you. Saeed, please share the number for Arabic translation.
إذا كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030. الرقم مجددا 313-241-7030. شكرا.
Thank you. Katie, please share the instructions for ASL for folks that have just arrived. Thank you. And to get us started again today, please welcome Arlisa Hurd.
Thank you, Christine. Hello, everyone. Again, my name is Arlisa Hurd. I am an organizing member of 482 Forward, a proud mother of 2 sons, and my family and I reside in the Focus Hope neighborhood, which is also known as Hope Village. You know, you've joined us over these last few weeks as we've brought all kinds of resources, great presenters, valuable information. All the while, most, if not all of us, have experienced a roller coaster ride of emotions. We've gone from grief to anger to moments of happiness to worry. All in all, in this pandemic has taken a toll on us. It's taken a toll on our families, our community, even our nation. But however, the one thing that we definitely can look forward to is knowing that these troubled times are only temporary. As my father used to say, pain has an expiration date on it. And I want to encourage all of us, all of you, that we will get through this together and we will come out on the other side of these troubled times stronger and better than before. These teletown halls help us to do just that. It is arming us with the information so that we can be stronger, we can be better, and more powerful than before. It's helping us help us. So today, we are so excited to have live participants on Detroit Public Television Facebook Live and onedetroitpbs.org. We want you to get answers to your questions so that you can be empowered, ready to come out of these troubled times better than ever. Now, let's hear from Cindy Gamboa. Cindy?
Thank you, Arlisa. Hi, everyone. Welcome back. I am Cindy Gamboa. I'm a proud parent of 3 wonderful children. I'm honored to be the organizing director at Detroit Hispanic Development Corporation, and I'm a proud member of the COVID313 Community Coalition. As a reminder, the COVID313 Community Coalition for Families and Students formed to ensure that everyone has regular information about what's happening during this crisis. Because as we heard, knowledge is power. The logos of these organizations are going to be shown on your screen, and we have members of each one of these organizations on this call today. The coalition is here for you, and we're going to continue to have these weekly teletown halls every Thursday from 12 to 2 to bring you the most up-to-date information to empower you. We're also going to continue to coordinate all of the resources that come across us on one site COVID313.org. So if you haven't visited, I encourage you to please go there and find resources that can help. Now I'm going to go ahead and remind you that last week we shared very important information about something that you can do right now, and that's completing your census. We know that this one act will take you about 10 minutes, but it's going to impact our city for the next 10 years, especially in the areas of education, healthcare, food access, and emergency services. So today we want to challenge you to join our Sidewalk Chalk Challenge. We all count 2020. All you have to do is go outside and draw bright, beautiful messages on your sidewalk to encourage others to complete their census. That way, when your neighbors are going out for a walk, trying to de-stress, they see these messages that you and your children are creating out to make our neighborhoods beautiful. We want you to share these messages, this beautiful artwork that you create. Tag your friends, challenge 5 of your family members and friends to do the same. If you tag Amo DHDC, you will be eligible for a weekly raffle of a $25 Visa gift card. We're also going to be sharing your artwork live on our next week's Teletown Hall. So please go out there, make our neighborhoods beautiful, and participate in encouraging your neighbors, family, and friends to take part in the census. So before I turn it over, we have amazing speakers, experts that are gonna talk to you between 12 and 2. You're gonna be given the opportunity to ask questions throughout this segment as well. I'm gonna turn it over to Nkenge so she can share very important information. Nkenge?
Hello, everyone. I'm Nkenge Browner. I am the organizing director at Mothering Justice. I'm also a mother of 2 boys, a 7th grader and a preschooler. Both attend Detroit Public Schools. I want to wish everyone a happy Black Maternal Health Week. We know, generally speaking, Black moms are at higher risk for infant and maternal mortality. That fear and risk is even greater right now during COVID-19. Mothering Justice would like to extend an invitation to match any expecting mom with a Black birth worker to open up the option of home birth. If you know someone who is expecting during this time and would like to have a free consultation with a Black birth worker about exploring the option of home birth, please contact motherinjustice.org. If you know a mother who has tested positive for COVID-19 and is breastfeeding or raising a toddler right now, please check out or contact Black Mamas Breastfeeding Alliance. They have tips on how to breastfeed safely during this time and respiratory precautions you can take for moms who are dealing directly with their toddlers. So thank you for joining us again as we continue to evolve as parents and as homeschooling teachers. Let us remember to capture these moments with our kids. Post and capture pics walking, cooking, and playing with your littles using the hashtag #TimeWithMyKid. If you're on Facebook Live, we have chat moderators that will answer your questions and post questions on the Zoom for our panelists to answer. If you are watching from One Detroit PBS.org, you can text us questions at 313-288-2082. Again, that's 313-288-2082. The rules for the chat are being posted below. We are committed as a group to posting the answer to questions that aren't answered early next week on our partner Facebooks. We'll also post a live recording of this on onedetroitpbs.org. If you would like to sign up for regular updates and get reminders from our group, please sign up by filling out the form in the chat on Facebook or texting your email to 313-288-2082. Again, that's 313-288-2082. For those of you who have just joined us, I will have Cindy, Said, and Katie tell us again how to connect if you are a Spanish, Arabic speaker, or need ASL interpretation. Cindy, please share the number for Spanish translation.
Si necesita traducción en español, por favor hable al 313-626-7440, 313-626-7440.
Thank you. Said, please share the number for the Arabic translation for folks who have just arrived.
إذا كنت بحاجة للترجمة إلى اللغة العربية الرجاء الاتصال على الرقم 313-241-7030. مرة جديدة الرقم هو 313-241-7030. وشكرا.
Thank you. Now I will turn it over to our moderators, Christine Bell and Jametta Lilly.
Thank you, Nkenge, and thank you for sharing all of that really important information for our new and expecting Black mothers. We are so grateful for our expert panelists that could join us today. We have asked them to share with us the 3 to 5 most important pieces of information that families and students need to know right now. For our experts, please remember to speak slowly for our translators. They want to make sure that they're translating the important information that you are sharing correctly. Also, turn off your camera when you're not speaking to ensure that our ASL interpreter can be seen. Please also mute yourself when you're not talking. You will have 5 minutes to share. Terry Whitfield will chat you your remaining time, and if you go over your 5 minutes, I will gently remind you to wrap up. We will be taking questions from our guests at the end of your segment. Jametta?
Thank you, Christine. And thank you to all the experts that are joining us. If you are just joining us, as Christine has noted, we want to hear from you. We want to stay connected. And so you can type your questions into the Facebook live chat or text 313-288-2082. Again, that's 313-288-2082. We have moderators and we have translators. So we want to make sure that we hear from you. Now we're going to move to our very first segment this morning, which will be on the impact of COVID on our immigrant brothers and sisters. So please, we'd like for you to welcome State Senator Stephanie Chang. Senator Chang will give us an update on the legislation that is before us now as we talk about COVID and its impacts on the immigrant community. Welcome, State Senator Chang.
Hi, everyone. Hopefully people can see me and hear me. My name's Stephanie Chang, and I'm the state senator for District 1, which includes a large portion of Detroit, a large portion of the east side, parts of Southwest Detroit, and a lot of downriver as well. And I want to say thank you to all the amazing organizations who have put this town hall together, and thank you for your work on, just really making sure that all of our residents know what is happening, what the resources are, and what they need to know about the crisis. As you all know, things are changing every day and sometimes multiple times a day in terms of what is happening. So I wanted to share a few things, and I know that Mirk is on, so I really think that they are the experts when it comes to some of the immigrants' rights issues. So I want to focus on a couple things that I'm working on, and then a resource guide. So I'll start off with that. I know there's a lot of resource guides out there. For those that live in or near my district, I did want to share ours. If you go to my website, it is SenatorStephanieChang.com. You can find a resource guide on there with everything from food and utilities to unemployment and a lot of other stuff. So feel free to check that out again at SenatorStephanieChang.com. Sometimes people are asking, well, what is the role of a legislator right now, since the legislature is actually not really meeting very much right now. We've actually been incredibly busy, obviously getting information out, providing resources, doing teletown halls, and just trying to get information out and answer a lot of constituent questions about all types of things. But in addition to that, we've also been really busy advocating for things like access to water, early prescription refills, pushing back tax day, working on issues facing people, facing folks in jails and prisons, the rationing of care issue, and making sure that people with chronic health conditions and people with disabilities get the care that they need. So we've been really busy, and out of that, you probably noticed that a number of the things that I've been advocating for are many of the things that you've been advocating for and have been put in place through executive order, but there are still a number of remaining issues. One of the things that is still remaining is this issue of making sure that everyone, regardless of their immigration status and what type of insurance they have, can get access to free testing and treatment for COVID-19. So that is something that I continue to work on and push for, to make sure that for emergency services, only Medicaid, to make sure that this would cover COVID treatment and testing costs. And we know that other states have done this. The last thing I'll do is I want to share what I'm working on with relation to the Senate Bipartisan Safe Behavior for Safe Workplaces work group. You might have seen this mentioned in some of the articles. I think this is probably one of the areas that there's a lot of public conversation about. When do we go back to work, and how do we do it safely? For me, I'm one of 3 Democrats on the 6-person work group, and we are tasked with coming up with recommendations to the governor regarding this topic. So before I say anything else, I'll share the website where you can actually fill out a survey, a very short survey, because we really, really want to hear from you. And that website is misafeworkplaces.com. So misafeworkplaces.com. If you go to that website, there's a short survey, and some of the things that, as a Democrat, that we've been talking about as part of this bipartisan work group is things like paid sick leave, things like how do we make sure that people have the proper safety protocols, how do we make sure we're not punishing workers if they choose to, make sure to speak up. We know that there have been almost 1,000 complaints to OSHA since the COVID crisis began. And so this is really, really critical. We have to make sure that when we all go back to work, that we do it safely and that it's done in phases, and that we're not putting people's lives and our public health at risk. There's a lot of rhetoric from the other side of the aisle around things that I won't even repeat here. So, but I think that what's important is to really prioritize saving people's lives, our health, and that we can, when we put people back to work, that we're doing it safely, including everyone, regardless of their immigration status, who they are, what type of work they do. So please fill out that survey if you can. We would really love to hear from you. We know that we're hearing from a lot of folks from the business community, and it's really, really important that we're hearing from workers about what it is that you need to be safe in your workplaces. So again, it's misafeworkplaces.com. Looking forward to your questions.
Thank you, Senator Chang. That was an incredible amount of important information. For those of you that may have missed some of the websites and telephone numbers that Senator Chang provided, those will be in our chat and also available after this broadcast. Next, we're so delighted to be able to have join us will be Tanya Morris Diaz. She is a staff attorney with the Michigan Immigrant Rights Center. Tanya, welcome.
Hi, thank you so much for having me.
You're welcome.
Thanks. So today I want to talk about public charge in the context of COVID-19 pandemic. But before I do that, I want to take a step back and just remind everyone, what is public charge? Public charge is a multi-factor test the US government performs when they're evaluating a green card application. The government is looking to see if the person applying for a green card is self-sufficient. So they look at a lot of different things, such as their age, their health, their education and employment history, their finances, and any past use of public benefits. So I want to stress that this really mostly applies to people who are applying for a green card based on a family member. So it's generally for people who do not have a green card, but have applied or plan to apply for one. So now let's take a look at public benefits, because this is one factor that's taken into consideration. The government doesn't consider all public benefits or public benefits received by family members. The government looks at public benefits such as SSI, TANF, food stamps, housing assistance, and Medicaid. However, there are some exceptions to Medicaid, such as emergency services or anyone accessing Medicaid that's under 21 or pregnant. So a question that we're hearing is, will my stimulus check count as a public benefit? And the answer is no. This is considered a tax credit and it will not affect a public charge determination. To be eligible for this stimulus check or rebate check, you must have filed 2019 or 2018 federal tax returns as a green card holder or with a valid Social Security number. So unfortunately, individuals who filed with an individual taxpayer identification number, or an ITIN, or for anyone else in their family who has an ITIN, they will not qualify for this rebate or stimulus check. Another question we've been hearing is, will unemployment count as a public benefit? And the answer is no. This is not on the list of public benefits the government will consider. To be eligible for unemployment, you must have a valid employment authorization or a Social Security number for the expanded unemployment benefits under the new federal stimulus. If you're undocumented or only have an ITIN, you're not eligible for unemployment insurance. And another question we've been asked is, how has COVID-19 affected a public charge determination? The government recently released a statement saying that any testing, treatment, or vaccine, once one is found, will not be considered as part of a public charge determination, even if that was provided by Medicaid. Now, because education and employment history may also be affected, the government is asking people to submit a statement as to how the policies, such as the stay-at-home order, may have affected your job or school. So for example, if someone is prevented from working or attending school and must rely on public benefits for the duration of the outbreak and recovery phase, they can provide an explanation and relevant supporting documentation. So any low-income individual can call Merck's intake line for legal assistance, and that number, which will be posted as well, is 734-239-6863. If you have any questions regarding employment as an immigrant worker, you can call our hotline at 1-800-968-4046. And a lot of the things that I talked about today, and maybe didn't get into the details, we also have up on our website, and we have lots of resources and guides for you. And you can check us out at www.michiganimmigrant.org. And I'm really looking forward to answering any questions you guys have.
Thank you so much, both of you, for your comments and this wealth of information. To our audience again, we want to hear from you. So we're going to now move into 10-minute segment for questions and answers. If you would like, you can type your information into our Facebook Live chat, or you can text it to 313-288-2082. Again, if you'd like to text, you may send it to 313-288-2082. At this point, we'd like to hear your questions and answers. Christine.
Thank you, Jametta. The first question that we have is for Senator Chang. You mentioned water. Just yesterday, water rates in Detroit were increased. Currently, there are thousands of residents in Detroit without water, even though it has been ordered to be restored, for the water to be restored. What is your role in ensuring that this takes place?
Yeah, so thank you for that. And just last week, Monica, who I know is speaking later, and I were part of a similar town hall, and we were talking specifically on this issue. You know, some of you probably know that well, Monica's been at this for many, many years, and I've been working on water since 2015, since I took office. I mean, the reality is that we have to pass the legislation to ensure a long-term solution to not only protect people from water shutoffs, but also to make sure that we are instituting water affordability plans and that we're putting additional protections in place. Michigan is one out of only a handful of states where our Public Services Commission doesn't have anything to do with water rates. We should be regulating our water rates. We wouldn't be in this situation if we had a strong system to do that. So, you know, I think that one of the things that I'm trying to do in the short term is obviously, you know, help to amplify where I can internally with folks in the administration to make sure that they are hearing the concerns around the implementation of the executive order and the proposals that are out there for, you know, actual real partnerships with the folks on the ground, because the reality is, you know, and I'm sure Monica will address this later, there are still people without water, and there are still people, you know, there's still water deliveries happening. And Monica, I'm working on getting some masks for you. But it's a serious problem that we definitely need to address in the short term. And I'll keep working there and help however I can. But at the same time, also totally recognize that long term, it's the legislation that we need to pass in order to ensure a long-term solution.
Thank you, Senator Chang. Tanya, this question is for you. There's a question regarding DACA recipients. Are they able to receive stimulus checks?
So yes, for any DACA recipient who has filed their federal income tax in 2018 or 2019 with their social security number, yes. However, if anyone in their household had an ITIN, then the answer would be unfortunately no.
Okay. And then also, stay up, Tanya, if you would. Community members are worried that if they get food assistance, either food stamps or food banks, this could impact their chances of getting a green card. Can it?
So food stamps are one of the public benefits that the government looks at in this multi-factor test. But in their statement, they have asked for people to provide an explanation as to how maybe using public benefits, or I'm sorry, how COVID-19 outbreak and recovery may have affected their use of public benefits. So it will be considered, but you can provide an explanation as to why you probably used food stamps during the pandemic.
Great, thank you. And there's a question regarding COVID testing. I'm gonna acknowledge that it's here. A few weeks ago, a person went to the hospital to take a test and was told that it's not for older folks. Senator Chang, do you have any insight to that? And if not, we'll have some health folks on later and we can ask that question later.
All I can say is I am so sorry for, I think we all know, right? There's not enough tests. And then the way that people at the front lines, obviously we're so thankful for everyone, all of our health professionals who are risking their lives to help save lives. At the same time, because there's limited tests, we're seeing different variations of behavior when people are asked to get a test. The responses are not consistent, and you know, we're definitely hearing of some people who are basically told to go home and not get a test. We're hearing of people who clearly have symptoms and probably have COVID, where you know they don't want them to come into the hospital because they think they might get sicker. It's it's a terrible part of this crisis where we know that even our numbers around who has, positive cases cannot be anywhere near the real total, because of this problem of not having enough tests. And I was on a call recently where we were talking with some public health folks and doctors from around the state, and it is just really, I think it's a shame. It's a terrible, terrible thing that we're dealing with. And I think that there are obviously folks at all levels of government trying to work on this. But I think that ultimately, I think that our federal government hasn't been doing its job of making sure that we have these readily available.
Thank you. And this is for both, I think, both Senator Chang and Tanya can speak to this next question. California just announced that they're providing aid to undocumented residents who are struggling due to COVID and a closed down economy. Are there any plans for Michigan to do something similar?
Maybe others can chime in. I haven't heard of anything, but I will definitely look into that California model. So whoever asked that question, would love if you can share a link or some information about that, and would love to share that with the administration.
Tanya, do you have any insight as to if Michigan is going to try to find a way for undocumented people to get stimulus relief?
So on a state level, I'm not aware. Merck and a lot of other organizations who are part of this meeting are part of a campaign for protecting immigrant families. And we are pushing to see how those who were not included in the last act are to be included in any acts coming forward. And so right now, what we have in this PIF coalition is we are asking anyone who has been denied any service because of their immigration status to please call our intake line and let us know. So we are gathering data on that, and we are keeping our ears open to hear of any sort of legislation that can come through to consider those who were missed in the last legislative act.
Thank you so much. And this is, it doesn't seem like this is a question, so I'm just gonna, as we wrap up here, I'm just gonna share it. In regards to water, it's unfair that many immigrants who always pay their bills are suddenly left without a job, are now facing shutoff. Isn't water an indispensable resource? They need it. So I just want to share that one of our viewers feels this way. Okay, I think that Senator Chang, there's an article that we're going to share with you later that was shared with us regarding what they're doing in California. So that also just came through. So thank you so much, Senator Chang and Tanya, and back to you, Jametta.
Yes, thank you. And I just have to say that those questions really raise another aspect of the coalition that we would love for our audience to know about us. And that is that all of us are advocates and warriors on those things that will keep our community healthy and thriving. So as our politicians and people that are in policy levels, we are encouraging you to please make sure that you are staying connected around these issues, because our voices and our advocacy is part of our power, and we absolutely need to exercise that together. And speaking of our power and working together, we want to make sure that before we go into our next segment, that we let you know that we're doing a census challenge. So stay tuned. We'll be talking more about that. We all count, and particularly COVID-19 is showing us how important it is for our community to have the resources that are critical for us to be able to address emergencies and the everyday reality of functioning as the city of Detroit and Metro Detroit. So at this point, we will move into one of our other core segments, which is education. And we know there's a significant number of questions and there's a lot of movement happening in this area. And so we're very pleased to be able to have experts in this area. And to start us off will be Dr. Nikolai Vitti, who is the superintendent of the Detroit Public Schools Community District. Dr. Vitti, welcome.
Thank you. Good to be here. Oh, start video. Can you hear me?
We can hear you fine, and now we can see you too.
Okay,
What? We
great.
just lost you. Go
Hi,
ahead.
how are you?
Good. Please go ahead.
Okay, thanks for having me. I believe most people would just want an update on where we are as a district. We have had our distance learning plan submitted and approved by Wayne Risa. We have begun to train our teachers on the online tools that we'll use. Essentially, we're taking lessons from our current curriculum, pre-K to 12th grade, in reading, math, science, and social studies. We have a website where the 10-week materials and assignments are on our website, so you can just go to our typical website and find those materials. We're going to be using Teams, which is a Microsoft tool that can be accessed through Clever. Our students are familiar with Clever. They use their logon and password, get to Clever, and then they can be connected to their teachers. All teachers' rosters are connected to Teams. So our vision is that every other day, based on the schedule, the students will be able to connect to their teacher through Teams. Now, this works really well if a student has a device, whether it's an Android, an iPhone, or a computer. But if they don't have those tools, then they can, if they just have a phone, even a phone with not a strong data plan, then they can use Teams to call in and hear, at least from an audio perspective, maybe not visually, the teacher talk through the lesson. But there are video lessons connected to all the assignments. We're going to print all the materials for families and students. Those can be picked up next week at the 19 food distribution sites. We're also, there are about 30 schools that will also distribute the packets. That's all on our website. The packet distribution will be next week from Monday through Friday, 8 a.m. to 1 p.m. None of the assignments are required. We're not going to grade the assignments, but teachers are going to be required to give feedback, to facilitate lessons, engage with students, one-on-one in small groups, conference, just talk to students on a social emotional level if that's what's needed. We have a hotline for homework, but we also have created a social emotional hotline if parents or students want to call that as well. Again, that's on our website. We'll have guidance counselors and social workers available through the hotline. We want to meet families and students where they're at. There are some that can do all of the work, and there are some families that are just trying to get by right now, and we understand that. So it may be a couple of lessons they'll complete. Maybe they can do iReady if they have a device and internet access. But again, none of this is required. It's just trying to continue some form of learning through this shutdown. Lastly, we're going to have our other personnel staff reach out to students and families as well. So academic interventionists can work with students one-on-one. Our special education resource teachers can work with students on the assignments on the phone, FaceTime, or through Teams. I would just end by saying we know the digital divide is real. This isn't a new challenge for us in Detroit. We've had positive momentum in the business community. about funding a tablet or laptop for all DPSCD families and offering 6 months of internet access. That's not confirmed yet. We're still working out the details, but I am very optimistic about the level of commitment and engagement from the business community. And I'm hopeful that in a week or so, we'll be able to announce that level of commitment in providing every family with a laptop or a tablet and internet access for the next 6 months. I said lastly, but there is a couple other points that I know are on people's mind. We created an FAQ, frequently asked question document, that covers everything I said and more. It's on our website. We alerted families about the FAQ through robocall and text message. But at a high level, we won't be giving a report card out for the third and fourth quarter. If a student had a D- or higher based on the third quarter grade, then they will receive a pass. All second semester grades will be pass fail. If a student has a D- or higher, they'll receive a pass. If they had a F, then they would receive a fail. Now, during the distance learning period, which is starting next Monday, April 20th, all the way until the end of the calendar year, if they complete their assignments, the teacher would be willing to increase that fail to a pass. There'll be no letter grade provided. Students' GPAs will remain neutral based on where the GPA was before the second semester started. But they will be able to obtain credits, which will allow them to graduate or be promoted to the next grade level. So I just tried to unpack a lot in a short amount of time, but open to any issues, questions that I was not able to address, or just more clarity on things that I said very quickly.
Yes, thank you, Dr. Vitti. It is certainly challenging to compress all the information that you have to share. But we want to also continue, and then we'll have an opportunity for the audience to join us by chat as well as ask questions by text. So our next speaker is going to be Ralph Bland, who is the founder and president of New Paradigm for Education. Ralph, we're pleased to have you join us. Ralph, are you available? So what we will do at this point is move forward.
Can you hear
I'm
me?
sorry. Okay, we can hear you now.
Can you see me?
Yes, we can.
Okay.
Welcome.
Thank you, thank you, thank you. So first I want to say thank you for having me today, but I want to say thank you for the first responders that's on the front line attacking this COVID-19 and putting their lives at risk daily. And definitely thank you for Governor Whitmer for her leadership in this time. So I'm Ralph Bland, Superintendent of New Paradigm for Education, and we have 6 charter schools in Detroit. Detroit Edison Public School Academy, Detroit Edison College Prep, which is both in the Eastern Market, University Yes Academy, which is on the West Side, New Paradigm College Prep, which is in Southwest Detroit, and New Paradigm Academy Glacier, which is in the Focus Hope neighborhood, and New Paradigm Levin Academy. We've been actively preparing and navigating the crisis since late February, preparing our operations and parents affairs teams to stand ready to provide resources to our students and families in the greater Detroit area. The most important point I want to emphasize this afternoon is the overall health and wellness of all our students and families. And that's our #1 priority in our district. And I just want to name a couple of points. Our families have been, we've been interacting with our families doing wellness checks. Our teachers and instructional staff they have been calling, sync our families to provide remote learning and the distant learning information. Before we even started, we reached out to families so they would know what our program would be about. And they were doing wellness checks multiple times a week. We're also participating in food distribution. The food distribution happens on Tuesdays and Thursdays from 11 to 2 o'clock at all our sites. We're also partnered with Gleaners and to assist us in the food distribution on opposite days. We also distributed technology. We got several tablets and laptops out to our families that were in need. Any households that didn't have internet connection, we provided them with a hotspot. We also handed out academic paper packets, and we're still trying to get those families connected with laptops or tablets that haven't received them yet. One of the things we've really been focused on is the trauma and the grief that our families are going through since COVID-19. So we've also partnered with Open Arms to help with grief counseling for students and also with families and staff members. And in addition to that, we've been connecting families with resources. Last week, we were able to pass out over 1,000 diapers to the community, in addition to 2,000 gloves to the Detroit Police Department, in addition to over 1,000 gloves to the Henry Ford Health System residential program, which focuses on nurses going into homes. We started our distance learning program March 23rd, and learning has continued and has had minimum interruptions. While we know nothing can take the place of a face-to-face contact with teachers, but we want to make sure meaningful learning can and is taking place with our partnerships with our parents and staff. And we want to try to bring a sense of normalcy to our families as well. So building off and maintaining close connection with our families, we were able to get 90% of our students on our digital platform, in addition to some academic packets. And the principals and the rest of our staff have continuously been making house calls, and anybody that could not come pick up a device from their school location, we dropped the device off at their home. So last thing, finally, I just wanted our parents and students, if they're on this call, we are here for them. The position we take is that, hey, we want to help you right now. And a lot of good things are happening, even though we are going through this time of COVID-19. And I just want to say the teachers across Michigan, just keep up the amazing work. And so we can see our teachers and the eagerness of parents to participate in remote learning, even though it's not the ideal situation that we all want to be in, but we definitely want to make the best of it.
Okay, thank you, Ralph, so much. We know the struggles that the schools are going through to address these issues of digital divide, as well as online and at-home learning, and to continue to share with us from an educator's perspective for one of the charter school groups is we're really pleased to have April Hines-Jen. She's a representative of the Leona group and is principal at the Cesar Chavez Academy Middle School. Welcome, April.
Hi, how are you? I'm trying to unmute. Can you hear me?
We can hear you fine. We don't have a visual, but we can hear you. And now we have a visual, I think, in just a moment.
I'm so sorry.
No worries.
Okay, what about now?
We can see you. Welcome.
Yes. Good morning and welcome, everyone. Thank you for having me and for giving us this opportunity to be able to speak on behalf of our wonderful students at Cesar Chavez Academy, especially during this time. This is a time to where community is needed and pulling together is needed while we are still on the front lines providing the education that our students need. And I'm very pleased to say that we submitted our plan to our authorizers, who are Saginaw Valley State University, who have been there to support us. And also with the assistance of our management company, we have been able to put quite a few things in play in regards to providing extra support to those who are on the front line. We just recognized them the other day, and it was very, very warm and touching to see all those people who are out there in this and still making sure our students have what they need. So We have quite a few things in play, and I'm going to try and get to everything, and look forward to hearing any questions at the end. One of the things we've done in an attempt to reach those in our community is we have, with the support of our teachers, again, as I mentioned, with my management company, the Leona Group, we have sent out technology to all those that need it to make sure that they are able to access the media that we have for them. And for those who have not reached out back to us, we're also sending out hard copy packets for them. We're trying to get them prepared to think about next year, and also to make sure that they are on task for this year. So we're sending out workbooks directly to their houses. We're sending out school supplies, paper, pencil, things that we used to provide them on a daily basis when they're at our school. And we know they still need them while they're at home. And this is one less worry that our parents have to worry about. And we're also working on using multiple steps of media for them. Our teachers are wonderful. I can't commend them enough. They have stepped up to make sure that they did not skip a beat with our students. Our teachers are reaching out via all platforms. Whatever we see that the students are able to access, that's what we're on. We're using things like Facebook Live. We just hosted a meeting a couple weeks back. Our spring break was last week, so we didn't do it. A couple weeks back to make sure that we speak to the community and let them know what's going on, to explain what the executive order means to them and their students, because a lot of them they hear it on the news, but they want to be able to understand it. So we held that. Also, we're again calling our parents. Our staff is working really, really hard. They're at home. They're using Google Voice. They've I don't know, is that for me for 2 minutes left? Hello?
Yes, hi. I think that might have been someone pinging you that we were asking you for about a minute or so.
Gotcha. Okay, understand. So with all the other things that we're doing, making sure that our families are eating, providing food to the community, providing EL support, calling our ELL students, because as you know, through Cesar Chavez Academy, we do have a high population of English as second language students. And we do have that population of students who, for most, would not qualify for some of the government programs. So we're making sure we're providing food for them and the resources for them that they need. Also, as I mentioned, we're providing EL support via video chats and phone calls. We're reaching out to our families. So we're trying to make sure we cover everything that we need that the students would benefit from. And I look forward to taking any questions or answering anything if I have not addressed it all at the end.
Yes, thank you so much, April. I know that was challenging for you, for Ralph, and certainly for Dr. Vitti. But now we want to make sure, as you've said, how do we get information to our parents? And not only that we get information to them, but they understand it and they can navigate the tremendous amount of material being literally tossed at them. So what we're going to do now is to go into a Q&A. If you have education questions, you may use the Facebook Live chat, or you may text us at 313-288-2082. Again, you can text us at 313-288-2082 if you have questions. So at this point, we'll transition for that. Christine.
Definitely have questions. So I am going to ask questions to Dr. Vitti first, because I understand that he's limited on time at the moment. So Dr. Vitti, how can parents contact their students' resource teachers? You're on mute.
Okay.
There you go.
By the way, hey, Ralph, good to see you. I'm glad you're healthy.
You too. I appreciate that. Good to see you also.
Our resource teachers should be reaching out directly to their students. So that's part of the commitment that we have with our teachers. So there should be direct outreach. So we don't have to worry about students or parents reaching out to those resource teachers. The resource teachers know who they're connected to as far as their IEPs, and they should be reaching out directly to students to finding out how they can support them at home in the best way possible.
Great, thank you. And then what's going to happen to those children who do not have resources to get to schools where they're giving out meals? Several places have closed, limiting their options.
So right now we're averaging about 100,000 meals a week. And that's with a Monday and Thursday distribution. We are opening up 2 more sites. One will be Roberto Clemente in Southwest Detroit because of the demand there. However, I want to be transparent and say we just had to close Munger as a food distribution site. So although we're opening up Roberto Clemente, actually it was today, we had to close Munger. So Munger should be offering food again by Thursday of next week, but today Munger was closed. So that may have led to some challenges with now only having Western or Roberto Clemente on the southwest side of the city. But Munger will be back next week. We also opened up Gompers on the west side because there was high demand in the Cody area. So we went from 17 to 19, although Munger did close today. We'll open up Munger again next week. And so I do believe that possibly by the beginning of May, we could be opening up more schools for food distribution. We're exploring the possibility of doing that, but I would say it's highly likely that more of our schools will be offering food by beginning of May, mid-May.
Great, thank you. And then so just a confirmation. So you said that so students can reach teachers through Teams. Is just confirming, is that what you said?
Yeah, it's called Teams, Teams. Our students would not necessarily be familiar with Teams. Our teachers were just trained on Teams. Teams is a tool within the Microsoft suite that is on our laptops. So our teachers now are, for the most part, familiar with Teams. And when they go into their laptops, their students are automatically populated in Teams. So eventually, as teachers start to reach out to students, if they have a device and internet access, then they'll be able to go through Clever, which our students are familiar with Clever because that's the portal that they use to get to iReady and Khan Academy as far as DPSCD is concerned. But that's going to be a learning process for a lot of our students and teachers in the next couple of weeks. But our teachers will be reaching out to students to just orientate them to the process as we move forward. And again, if there is not consistent access to a device or internet access, then we are printing the academic packets and those will be available next week. So that's another way of engaging the materials outside of an online platform.
Great, thank you. And then what is the plan for summer school?
Yeah, so, depending on just where we are from a medical and health perspective across the city, if possible, we would like to offer face-to-face summer school starting in July. But that is dependent on where we stand with just from a health and medical perspective in the city. So if things continue to move in a positive direction and we are cleared to offer face-to-face summer school, then we would likely do that K through 12th grade, focus on course recovery for high school students and just enrichment and remediation at the K-8 level. For the past couple of years, we've only had select sites geographically open for summer school. We would open more sites for summer school. It wouldn't be a requirement, but we would definitely use more buildings and open it up more across the city for access. But it wouldn't be required and it wouldn't be offered at every school throughout the DPSCD family.
Great. Will the sanctuary school policy still be honored now that school is being conducted from home? How is the district keeping the commitment to protect and support our undocumented communities?
Yeah, absolutely. There would be no suspension of that policy. And if there, as I always say, if there's any issues or concerns, you can reach out directly to me or reach out to an advocate that you're familiar with and comfortable with and trust, and they can reach out to me. But there should be full fidelity to that policy as we do online learning.
Okay. Which DPS schools are passing out technology one more time, Dr. VD?
So we're not passing out technology yet. We're working with the business community right now for an at-scale solution. So that commitment is not confirmed, although we have positive momentum. Next week, we're handing out packets. So that's the printed materials that will be taught through online. And that will be at the 19 current food distribution sites. And there are an additional 30 schools that will be giving out packets. If you go to the DPSCD website, there's a separate website dedicated to COVID-19, and all those additional schools are listed there.
Okay, so I've got two more questions for you. One is short. How are you going to help students with special needs?
So our resource teachers, based on the earlier question, our resource teachers, which are the teachers that typically work with students in small groups, individually or in a resource room, they will be reaching out to students and families about assisting with the assignments that are assigned and determining the best way to support students completing those assignments or any other discussions that they need to have. As far as our students that are in our ESE centers, so those are students with the more extreme exceptionalities, we're still working through what we can do with those students because most, a virtual platform is very difficult for those students because their needs and their learning pathways are significantly different, obviously, than other students. So we're trying to think out of the box in a way to best support those students, but that is still a work in progress right now.
Okay, and then there was an ask from a parent that could you please share with I think it's probably the school leader from Detroit School of Performing Arts to reach out to parents, especially ninth grade teachers, especially the ninth grade teachers who have continually failed to address the needs of the students. Some teachers have not updated their grades in Power School since February or have not graded students' assignments. So I don't know if you want to give some information about why that might be, but I'll go ahead and let you respond to that.
Yeah, I would believe that most teachers have upgraded their grades for the third quarter, but we are setting a deadline for that. I believe it's the 20th where those grades have to be inputted. So all the grades that were related to homework, quizzes, tests before the shutdown about March 12th, all those grades should be in by the 20th, and that will determine the pass-fail status. So students know where they stand as far as their credits and promotion. So we're sharing that now with principals and teachers, but what we'll do based on the question is we probably need to share that more with our students and our parents. So I'll work on that this week to get that information out to all parents and students.
Great. And then someone just commented that this is a lot of really great information. And is there a paper form where this information is that folks can refer back to?
Yeah, just while we were working through this, there was a number of questions that accumulated. So we do have a frequently asked questions document, again, on our website. If you go to the DPSCD website, you'll see an FAQ document. We also sent a robocall and a text message to all families that this FAQ existed. So a lot of people have been catching up on where we stand with online learning, distance learning, credits, graduation, prom, etc., through that document.
Great, thank you, Dr. Feedy. We're going to extend this segment a little bit longer so that April and Ralph can answer questions as well. And so April, while I know that you are representing the Leona group, I just wanted to share with you that there are parents whose kids attend Joy Prep Academy, managed by the Leona group, who have not had any support from their school. What do you recommend?
I will say this, reach out to your school leaders. All of the school leaders are very easy to contact and they're very passionate about student learning. And as a matter of fact, we just had a meeting, I want to say about a week ago, and the school was dealing with some difficult issues with a staff member who had become ill. So they were providing supports for that, but there's no reason for anything else not to be done. But they are working on something. Every last one of us have a plan. It's something that we've been working on. And I'm sure if they reached out to their school leader, I can't remember, recall the name, I'm pretty sure they'll get some answers. And the schools are open as far as phone calls. So if you call the school, just like if you were to call my school, you can leave a voicemail message and the turnaround was usually within 24 hours.
Great. And so Dr. Vitti had to get off. This is for all of, for Ralph, April, and Dr. Vitti. If parents don't have transportation to pick up packets and food, are there other options? And then also, there's been a couple of folks that have said, could community organizations pick up for families and hand deliver? So could you speak to that a little bit?
You want to go first, Ralph?
Okay, thank you. So for our new paradigm for education families, we do deliver meals to homes and the academic packets and even the tech devices. But if it's any other members of the community that need transportation as far as food distribution, you can email me at ralph@npfenow.org, and we can make sure that food gets delivered to you, even if you're not within our school, our family of schools, because our number one priority is not just looking out for our schools, but also looking out for the community. So if families need transportation in that manner, they can email me and I can help them get that transportation.
Great, thank you. April?
Yes, and as far as some of our schools have, we have bus drivers that have actually stopped off to deliver food. So if you are in need of something, please reach out to the school that your child attends. And as far as the work packets, we have worked together and created a comprehensive plan to where every child is getting a packet sent home in the mail. So if you can't get out, we don't want you out. I mean, the executive order said, do not come out. We want you safe. We are sending that out to you. And as far as the online platform, as I mentioned, we are not waiting for you to come to us at Cesar Chavez Academy at any of our schools. We're actually reaching out to you. Just let us know what you need and we'll see what we can do to get it to you.
Great. I'd like you both to answer the question that was asked of Dr. Vitti earlier around completing IEPs and how both of your districts are handling that.
I'll let you take that.
Okay, no worries.
Sure.
We are actually working and holding IEPs. They're done virtually, of course, to try to make sure we keep up with compliance. And not just for the compliance piece, to make sure our students are getting services and the supports they needed. I mean, that's one of the reasons why they have an IEP, because they need extra help. And we don't want that to lapse. We also have, like I mentioned, as we reach out to parents and provide supports. For example, I'm going to give you one from my school, if you don't mind. We have a student who is ASD to the point to where he has to have routine. You can't change routine because it's very difficult. We've had his aid support service as well as the teachers have been reaching out to him on a consistent basis. And based on from what the parent is saying, this is helping him to keep a kind of normalcy in this kind of craziness.
Great,
So-
thank you. Ralph, go ahead.
Okay, so for our students that need resource support, our teachers have reached out to those students to make sure, number one, those students have received devices. Number two, that we're following their IEP plan, and also giving additional services. And which I didn't mention earlier, we are also supporting our students by offering tutoring to those students on 2 days out of the week. In addition to our students that don't receive those services, they also have tutoring too if they need it.
Great, thank you, Ralph. So both of you have schools in predominantly Spanish-speaking communities. And so a question has come in that is related to that. How are you helping families that only speak Spanish? All material are in English and parents don't know how to help their child.
So the materials that we're passing out actually should be in both Spanish and English.
Okay.
And a lot of our staff is bilingual, and we're able to translate with those parents. And for parents that have received devices that are not bilingual, we have been able to get them devices and plus hotspots if they didn't have internet access.
Great, thank you. April?
Yes, and we're pretty much the same thing. The work that we're sending out is done in both languages, just like we've done with any information we send out to parents. We always have it English and Spanish. And one thing that the Leona group has worked really hard to do is, because we do have a large bilingual staff and we are reaching out to our parents in both English and Spanish, we've created a call log to where those who are able to translate can also translate for schools who may not have someone at that time, because people get sick.
Great, thank you so much. If we didn't get to your question, we promise we'll answer it and have it posted next week. Thank you so much to Ralph and April. This was really valuable information, and as you can tell, parents have a lot of questions. So thank you both for being here.
Okay.
Anna?
And if and I'll be more than glad to come on next Thursday and continue to ask questions if parents have questions or if they had needs in the community around education.
And I as well. And we are also going to continue on with our Facebook Lives for our parents. They can just check our website. We're going to try to do that every 2 weeks or so to answer those questions. But again, we're always available. Just reach out to us.
I want to thank you so much, all of our educators. And we want to remind parents that this is such a critical time, that you are in touch with your schools, with your teachers, and building a relationship so that you have online learning going on, but so importantly, that you're reinforcing learning at home. But also there's something else that is very important for us to zoom in our attention to, and that's our health. And so in this segment, it's really important that we're going to hear both from those that are in physical health as well as mental health. But we also want to make sure and say to everyone that we are so delighted to lift up that this is Black Maternal Health Week. We know across the country that African American women are dying at rates much higher in terms of their mortality, as well as our babies have been doing that historically. So working together with our local health departments, Mothering Justice, and other programs, we are here to make sure that our community stays safe and questions around pregnancy are getting addressed. So to help us do some of this, we're so pleased to have back with us is Crystal Hepburn, who is the team lead for Children's Special Health Care at the Detroit Health Department. Welcome, Crystal.
Hi, good afternoon, Jametta. Thank you so much. And I do apologize, I don't have a video because I'm on a desktop computer at work. I would like to go ahead and review some of the signs and symptoms with coronavirus, what we can do to continue to be healthy, and also go ahead and address the information and availability of what we have for those that are pregnant. At the moment, continue to wash your hands, avoid touching your face, disinfect surfaces. We want individuals to stay inside, minimize errands outside the home, and if they do have to go outside the home, to please have a mask or a face covering such as a scarf or a bandana, and maintain social distancing. We do still have our testing site available, which requires a doctor's prescription, an appointment to be organized by calling 313-230-0505. Transportation is available for $2 round trip for those that may need transportation. We also want to make sure that individuals are checking in with family and friends, whether it be through the phone or Facebook, instead of face-to-face gatherings. Moving on to the individuals that are pregnant. Pregnant women may have an increased risk due to the changes of their body. They are at a higher risk of severe illness with infection due to any type of viruses such as COVID-19, flu, and respiratory infections. This is a brand new virus. We don't have much data as the moment, but we do continue to take the statistics down and inform individuals. Mother to child transmission of the coronavirus during pregnancy is very unlikely. But after the birth of the newborn, it is possible that the newborn has the spread of the COVID-19. So we want to ensure individuals after birth of their child are maintaining social distancing, staying at home, protecting their child. Very few babies, as mentioned, have tested positive for the virus. The virus has also not been detected in amniotic fluid or breast milk. At the moment, there's a lot of stress and anxiety. I would recommend speaking to your OB/GYN to discuss what the birthing process will be like, to have a good understanding of what to expect during the time of delivery. No visitors and no support is very scary in addition to the current COVID-19 outbreak. I want to remind everyone that the Detroit WIC locations are providing virtual services for nutrition education and nutritious food, breastfeeding counseling, and also support. You can call or text 313-246-2866 or 313-288-8799. I also want to make sure that individuals are aware that we have a Sister Friends program at the Detroit Health Department. Its goal is to support and educate those expecting moms throughout the first year of birth after their child is delivered. Please call 313-961-BABY or 313-961-2229. I want to remind individuals that we do have a phone number that is operational and answered 24 hours a day, 7 days a week for individuals that have questions. The phone number is 313-876-4000. You can press number 1. Also on the site, we do have our email address, which is monitored, and that is dhdOutbreak@detroitmi.gov, and I will be available for questions at the end. Thank you.
Thank you so much, Crystal. And again, this slide is available. And we know that pregnancy in itself, and particularly those first few weeks of giving birth, are stressful on moms and the whole family. And COVID itself is stressful. So it's really important that we get a chance to hear from our mental health professionals who have a continuum of resources to help us navigate our feelings, our concerns, and in some cases, even in fact, depression. And so we're really pleased to welcome back Laura Lefevre, who is the Director for Community Projects at Children's Center of Wayne County. Laura.
Good afternoon. Thank you, Jametta. I appreciate being asked to return. So on behalf of the Children's Center, thank you and good afternoon to everyone. I've had the opportunity to speak or for us to be on this platform the past couple of weeks and to talk about and speak about the importance of mental health for our parents and for our children. And I want to continue to speak about the importance of mental health for our children. For all of us is so important, but my focus today, again, is around our children and their needs. And so I mentioned before that this is not the time if your child is currently or has currently been in treatment prior to the COVID-19 crisis. Now is not the time to stop treatment. It is so important to continue to make sure that you are connecting with your child's clinician and to make sure that the relationship continues. One of the things that I want to overemphasize is that mental health providers are here, they are available, though not in the physical sites, but via telehealth. And what has been going on across our city and our county, all of the providers are working to provide telehealth platforms. And what I mean by that is the opportunity to still connect with your clinician via the phone or computer through different avenues such as Facebook, Google Docs, Zoom, or just audio, just picking up the phone and having a conversation. So I want to speak a little bit about telehealth and how parents can support their child through the process of telehealth. Because right now we have competing priorities around usage for computer, usage for the phone. We have families who are working daily to still try to file for unemployment. We have children receiving, as you heard from our school leaders, information around their education, their curriculum. So everyone is trying to use the phone, they're trying to use the computer. And one thing, if this hasn't shown us, this COVID virus has shown us a lot of things, but it has shown us the gap in technology that we have across our city. So as I talk about telehealth, parents understand, I know that there's challenges and their competing priorities. So one thing about telehealth and the ongoing treatment for your children, make sure when you're meeting or speaking with your child's clinician, keep track of those appointments. It's so important. I myself found once this all started, I stopped using my appointment book. One of the silliest things that I could have done. And the other day I said, oh my God, let me pick my appointment back, my book back up and just start scheduling everything as I did before. Keep track of the appointments because we have so much going on. Writing things down are so important. So keep track of those appointments. The other thing you want to do with your telehealth medicine, your telehealth appointments, provide a quiet space for your child. Just as they were meeting with a clinician in the office, they also at home need a quiet space to connect with that therapist. Allow them to bring their toys, gadgets, coloring books, all of that. We need something to manipulate with our hands, and that's okay. So if they want to bring their toys, their dolls, it's perfectly fine. It helps with the engagement process. Parents, also make sure you stay connected with the clinician. This is not the time to just say, okay, I want you to meet with my child. The clinician wants to meet with you as well and do that family therapy connection. Therapists want to make sure if you're seeing any additional signs of depression, anxiety, loneliness, excessive sleep, these are all things that we need to make sure that we're tracking during this time for not only our children, but for ourselves, because again, these are very stressful times. One of the things that, let me make sure that I'm not missing anything in terms of reminders. Again, I said making sure that we participate in the therapeutic process, Family therapy is so important. So just as is important for that little one that's identified that has the needs right now, bring the whole family in when it's important. So this is not the time to stop. If you feel that your child is in need of behavioral health, mental health services, that's fine, that's great. Have the conversation and reach out. Children's Center is one of several providers throughout Detroit, Wayne County that are currently providing ongoing services. And so if you're not familiar with how to access services for mental health, I want to make sure that I provide you the information to get them. And for the Wayne County Access Line, and that's for Detroit and Wayne County, it's 1-800-241-4949. And that is an important number to make sure that you have on your refrigerator, in your appointment book. And if you don't need it today, you may have it for tomorrow. Or if you know a family member or a neighbor or a friend that's suffering, their children are having difficult times, share that number, because there are providers that are out here willing and ready to help.
Thank you so much, Laura. Christine, do we have some questions?
We do. So the first question is for our health department representative, Crystal. Does the health department have bilingual lines, specifically for Spanish and Arabic, but do you have them for other languages as well?
Okay, great question. We are pleased to go ahead and advise everyone that we do have a language line available. We have Spanish, Arabic, Bengali, and many other languages. Individuals just have to advise when they speak to a representative that they would prefer to speak in another language.
Great, thank you. And then another question, Crystal. Has Detroit moved forward with the plan to do mobile testing in neighborhoods? We're still hearing, I should say this person is still hearing that it's difficult for some people to get accessible and free tests.
Yes, I understand that there have been some difficulties getting the free testing. So the test is actually free through federally qualified health centers. Especially we've noticed and have had questions about the 48209 and 48210 zip codes. So the Felita Wilson Health Center is available to provide the test free of charge. However, there may be a doctor's cost or an associated cost. If an individual has insurance, the facility will bill their insurance for the cost of the doctor visit. If individuals are undocumented or have no insurance, they do have a sliding scale available. That is anywhere from $20 to $90 based on the family's income. I double checked this morning. They are open Monday from 10 until 6, Tuesday from 9 until 5. For the most part, their visits are telehealth. They are still accepting and working with individuals that are pregnant on a face-to-face basis, because it is so important to make sure we get them in for their regular appointments. But the testing is free. I'm not sure about the mobile units within neighborhoods as of yet.
And then Crystal, the last question is Henry Ford Hospital, and this was translated, but Henry Ford Hospital was refusing to test older people for COVID-19. Why is that?
I'm not sure why Henry Ford may be refusing testing. I know that the Detroit Health Department has been going into seniors' residences, nursing homes, long-term care facilities, providing screening as well as testing. At the moment, it's been 2 to 3 times a week, and moving forward, they will continue to do that as needed. There's many facilities that have older individuals that have tested positive, and they are susceptible for complex comorbidities because of their health, as well as complications. So that's a population that we really want to focus on if they have signs and symptoms. I can't speak for Henry Ford, so I apologize.
No, that's okay. And so should folks call the health department if they need access to testing and they've been told this?
If they need access to testing, we can go ahead and provide referrals for the FQHCs. We
Great.
do have testing on site only for emergency responders. That would be police, fire, EMTs, and bus drivers at the moment. So individuals are requested to call either an FQHC or their insurance company to have a referral to a PCP or a provider. The Detroit Health Department does have a number of physicians listed. They are accepting new clients, as well as it'll note whether they take private insurance, Medicaid, whether they're East or West. So you can go to detroitmi.gov/health, and it will go ahead and have a little box there, and it says, do you need a doctor?
Great, thank you. If my child is having a crisis that is non-COVID related, can they still go to the hospital?
They can still go to the hospital related to other acute situations. If individuals break an arm, break a leg, have some type of detrimental complex injury, I would recommend that they do go to the hospital. The emergency rooms are still open. A lot of the clinics, because I work with children with special healthcare services and special healthcare needs, a lot of the clinics are doing the telehealth. So a lot of the diabetic clinics, various items like that, are speaking to clients still over the phone. But I would definitely recommend if they need emergency treatment, emergency services, they should go to the emergency room.
Great. Last question, and this is for you, Laura. Regarding mental health, can you talk about resources available for LGBTQ youth whose main support system is often friends at school? And can you advise parents on how to support their LGBTQ children? And we've got limited time, so.
That's a really wonderful question. If you're not familiar with Ruth Ellis Center in Highland Park, they are a phenomenal organization that is everything LGBTQ community. So please reach out to them. All the providers will support the community, but specifically if you're looking for everything that's LGBTQ, Ruth Ellis, and that number is 313-252-1950. Wonderful organization, wonderful individuals.
Thank you, Laura, and we'll give you an opportunity to maybe dive deeper on that question when we post them next week. Thank you so much. Jametta?
Okay, thank you so much. We're going to move to our last segment for our town hall, and that's the critical area of housing as well as water, because water access is so critical for our health. And our first speaker will be Michele Oberho, who is the Director of Tax Foreclosure Prevention at the United Community Housing Coalition. Michele, welcome. You have 5 minutes.
Hello, can you hear me?
Yes, we can.
Hi everyone. So thank you. So I'd just like to see what I can speak about that would be most relevant to the group. Regarding my work, which is to focus on tax foreclosure, the update is that the Wayne County Treasurer has announced a moratorium on tax foreclosure for the year 2020. So anyone who was at risk of losing their home is now, they still owe the money, the debt is still owing on the property, but they cannot be foreclosed upon by the Wayne County Treasurer. So that has provided a relief in terms of this time constraint for a lot of homeowners. Not everyone with property tax issues is a homeowner though. The majority of tax foreclosed properties nowadays are actually landlord owned and renter occupied. So that can be a challenge for renters that their landlord doesn't necessarily have to pay the tax, but they may have a burden of continuing to pay rent. Fortunately, we do have a moratorium, which is much more short term. We have a temporary moratorium on evictions in the 36th District Court that is currently up to the end of the month. And this is not my area of expertise, but I will let you know that currently it's not lawful for a bailiff to come out. You know, there's no active evictions happening right now. However, there were a lot of cases in process right before the pause. And so we are preparing at UCHC to make sure that we're not seeing a crush of evictions happening as soon as the bar is lifted. We found that within 3 days alone of court cases, there were 500 cases, and 150 of them have a writ, which means a bailiff could be summoned with very short notice. So we're trying to make sure that we don't find immediate displacement following this crisis. Back to the property tax foreclosure, they're really important updates if you are a homeowner, if you're low income. The city of Detroit has done a very excellent job in making available the HP TAP. It's a really bad name. It goes by HP TAP, poverty exemption, property tax exemption. What it is a discount on your current year property taxes if you are a low income owner. And that is wonderful. But now you can leverage your HP TAP to actually get out of a lot of your debt with the Wayne County Treasurer. Just before the pandemic took over, we had a law passed in the state of Michigan legislature, which enables low-income owners who are approved for their poverty exemption to receive massive discounts on their delinquent taxes. And it's going to change the game for a lot of homeowners who have just been carrying this debt year to year. And that is called PAYS, P-A-Y-S. It's an acronym standing for Pay As You Stay. And we're really encouraging people to pay off in a lump sum. They can see huge savings, and we don't want to run any risk that if they fail to adhere perfectly to the plan that they might get kicked off. So we're working with people now. The Wayne County Treasurer claims that this will be implemented this month, although we haven't yet seen anyone get access to it. If anyone has questions about tax foreclosure, we have a hotline. We are operating it remotely. We have a lot of data access we can do remotely. Our number is 313-405-7726. That might have been 5 minutes, but I'll stop there.
That was great, Michele. Thank you for being so informative and timely. We're now going to shift to Joe McGuire. Joe is joining us again as the housing attorney at the Detroit Justice Center. Welcome back, Joe. You have 5 minutes.
Thank you. So I'm going to repeat some stuff from the last time I was here. And also, we are lucky to have Jim Shaftsma, who's going to speak after me and fill in the gaps from what I'm saying. So the first thing I would encourage people to do is go to michiganlegalhelp.org/coronavirus. And that has a very helpful list of resources and information about how the coronavirus pandemic has affected a whole host of legal issues for people in Michigan. And that includes housing issues and eviction issues. So if you have questions about how this might have affected some sort of housing related legal issue or really other legal issues you might have, that is a very helpful resource. So to continue and add on a little bit to what Michele said, it is true, Wayne County, the Wayne County Treasurer is stopping all property tax foreclosures this year. And you still have to pay your taxes, but and late fees and interest may still be charged. And outside of Wayne County, across Michigan, Governor Whitmer has signed an executive order extending the normal redemption period for paying your delinquent property taxes from March 31st through to May 29th. So if you know anybody who lives outside of Wayne County that isn't covered by that Wayne County Treasurer decision, then they are covered at least by Governor Whitmer's executive order. And that was Executive Order 2020-14, if you want to look it up. So the first thing I want to say is if you have a mortgage that you need to pay, you may be entitled to relief. And Jim is going to get into more specifics about that. But Congress passed something called the CARES Act, and that's an acronym. And it affects people who have a mortgage that is backed by the federal government in any kind of way. And I would really encourage people to look this up because your mortgage might be backed by the federal government without you knowing. Even if you work with a mortgage servicer that is a company like Bank of America or Chase, the federal government might actually be involved. And there's ways to look that up that Jim will get into. I would really encourage people to draw on a couple resources. One is the Consumer Financial Protection Bureau's website. And if you Google Consumer Financial Protection Bureau mortgage relief options, they have a very helpful guide available online and a lot of information that you can use to see if you are covered by this and what exactly is the relief that is offered. If you are a tenant, there's other relief that might be available to you as well. So if you are a tenant in either federally subsidized housing, which a lot of people would call Section 8, there's a lot of different kinds of federally subsidized housing, or if you're a tenant that simply rents a home that is has a mortgage on it that is one of those federally backed mortgages, you may also be entitled to relief through the CARES Act that Congress passed recently. And Jim will again get into more specifics about that after I speak. He's talking right after me. And I would really encourage people in this case, look up the National Housing Law Project Eviction Moratorium Summary. If you Google National Housing Law Project CARES Act Summary, it should pop up as the first result. And that is a very helpful summary. And you might be surprised that you might be entitled to relief or at least protection from eviction during this time. So I really encourage people to look that up. And even if you aren't covered by either of those parts of the CARES Act, you might also be protected. So Governor Whitmer signed an executive order 2020-19, which states that there will be no evictions in residential housing through April 17th, 2020, which is tomorrow. But I would really encourage everybody to look at the news and go on Governor Whitmer's website and check it tomorrow or on Monday, because she might extend it or expand it in some kind of way. So I would really encourage people to keep up to date on that. There's only one significant exception to the prohibition on evictions, which is except when the tenant, vendee, or person holding under them poses a substantial risk to another person or an imminent and severe risk to property. And so unless you're covered by that, you as a tenant or land contract vendee are protected from eviction during this time. And if your landlord is trying to evict you during this time, that is a misdemeanor under the executive order and the law of Michigan. So you should report them if they are trying to do that. It does not mean that if you are a tenant that is not covered by the CARES Act, Governor Whitmer, her executive order does not mean that you don't have to pay rent. The law on paying rent still applies just like it did before. It is unaffected by the executive order that Governor Whitmer signed. All it means is that your landlord cannot evict you during this time. And if you live in Detroit, the 36th District Court, which is the court that handles eviction cases, has its own moratorium, which means a prohibition on evictions that goes through April 30th. And you can look that up. That's also on the 36th District Court website. And so that goes further. My general advice to people is talk to your fellow tenants, look up the information, and seek legal advice. There's a lot of resources available to people. The United Community Housing Coalition, Michigan Legal Services, Lakeshore Legal Aid and Defender Association, and also groups like Detroit Eviction Defense, which are solidarity groups.
Thank you so much, Joe. I'm sorry. We've got to, we're getting close on time here, so we've got to bring up our next person. And you're going to be here for question and answer. So thank you so much for that information. Jametta?
Yes, hi. And again, thank you, Joe. As you mentioned, we're really pleased to have Jen Chestnut to join us from the Michigan Poverty Law Program Advisory Board. Jim, welcome. You have 5 minutes and we're looking forward to hearing from you.
Thanks, Jametta, and good afternoon to you and everyone else. Hope that you out there are doing well in this time like no other. So yeah, as Joe said, I'm going to try to build on some of his comments. I'll quickly talk about the governor's executive order that, as Joe said, prohibits most evictions. And so that really only applies to the last state engage in the eviction process, which is the actual physical eviction from premises. So it's a good protection. We wish it was a little stronger. And again, you'll hear this phrase from me, as Joe said a few times, but that we expect that the governor will extend that order, that executive order prohibiting most evictions before tomorrow. And we hope that there might even be some improvements in it. You know, one area that I didn't know was as severe as it is are evictions from hotels and motels. So that's a tough area for the governor to include in an executive order for reasons I don't have time to get into, but we're hoping there'll be some protection at least for residents of certain hotels and motels who are especially vulnerable to housing loss at this time, and certainly all the public health consequences that loss of housing presents. So, I'll credit the governor. I think she's done a great job under very difficult circumstances. Joe also mentioned this CARES Act. So this is this federal law that was passed and enacted last month, and CARES stands for Coronavirus Aid, Relief, and Economic Security Act. So it provides some protections for both homeowners with certain mortgages, as Joe said, these federally backed mortgages. And what it does for them is that it provides an eviction moratorium. As Joe said, that's a prohibition, a foreclosure moratorium. So a prohibition against the lenders of those mortgages from doing foreclosures until May 17th, which isn't a very long moratorium. We hope that it will be extended, but it also very significantly allows them to get what's called some forbearance relief. So some delay in their obligation to make their mortgage payments, but that's only on request by homeowners to their lenders for such forbearance relief. And that forbearance relief can last up to 360 days. But again, that coverage is limited to these so-called federally backed mortgages. There are a substantial number of mortgages, but not all mortgages. And for those mortgages, and there are a significant number that aren't so-called federally backed mortgages and are commonly known as private label mortgages, there currently is no moratorium on their foreclosure under either state or federal law. So, we think that it's the case that not many of these lenders are foreclosing those mortgages, but there's no legal prohibition or limit on their doing so. So for those homeowners with those private label mortgages, there is some vulnerability. And this CARES Act, as Joe said, also provides some protection to tenants in federally assisted properties. And that includes the properties, the rental housing programs that Joe mentioned, such as the Section 8 programs, public housing, low-income housing tax credit, and the so-called continuum of care homelessness program. So it has really broad coverage. And what that moratorium does is says that the housing providers, the landlords in those situations, may not file an eviction case in court until really August 24th. So that's a fairly lengthy, and it doesn't relieve people of their obligation to pay rent, but it does prohibit those landlords from filing eviction cases for non-payment related matters. So it doesn't limit their ability to file evictions in other situations.
Jim.
Yes.
So Jim, thank you so much. We did have one really important question before we make an adjustment in our time. And I'll just go ahead and share it. And that is, what assistance is there for landlords? If you could answer that real quickly, and then we'll make sure all that other contact information is in the chat.
Yeah, well, landlords, it depends. If they have a mortgage, that there could be some foreclosure protection for them or forbearance. But so it depends on what landlords we're talking about. Large landlords, I think, will be able to take care of themselves. That smaller landlords are going to have to work with tenants to see what can be worked out that's mutually beneficial to both of them.
Okay. Jim, thank you so much. And we also want to hit pause and thank all of the experts, because your commitment to our families and our community is so important. Knowledge is power. And at this point in time, we need to believe in our ability to take knowledge and keep ourselves safe and healthy. Thank you so much. And I'm going to transition it to Christine to close us out. Thank you for the blessing of being part of this wonderful town hall.
Thank you, Jametta. We've reached 1:55 and it's time to wrap up our town hall. Thank you to all of our panelists and thank you to each of you for joining us today. Please remember, if your question wasn't answered, do not worry. We are committed to getting the answers for you and posting them next week on onedetroitpbs.org. Again, we will be hosting these town halls every Thursday from 12 to 2 to bring the most up-to-date information. Please sign up for regular updates by filling out the form in the chat or put your email or phone number in the chat on Facebook or text it to us at 313-288-2082. Again, 313-288-2082. Before we go, we're posting a survey in the chat on Facebook. Please take a minute to fill it out. We really want to hear from you. We will also be picking 2 people who fill out the whole survey to win $25 Visa gift cards. So there's an incentive to fill it out. So please fill it out. We would also love for you to join 482 Forward's Youth Organizing Collective Instagram live town hall about water access during COVID-19 today at 4 p.m. Please join to have any of your water related questions answered. Also, we want to share one very important action that everyone can take to help our city and its people, and it's to fill out the 2020 census. This one action will take most people about 10 minutes, and it'll impact our city for the next 10 years, especially in the areas of education, healthcare, food, and emergency services. And we all know that these things are so critical in a crisis. Please participate in the sidewalk challenge that we talked about at the beginning of our town hall using the hashtag #WeAllCount. Please also spread the word about the census. Participation in the census has never been easier. You can go online to 2020census.gov or call the toll-free numbers that you see on the screen now. But there's an English line, a Spanish line, and an Arabic line. We also would love for you to take our challenge. With all that is going on, we need to bring a little joy. So today we are launching the hashtag Time with My Child. We would love to see your pictures on how you're spending time with your children, and we will highlight them next week in our town hall. Also, we want to hear what you are interested in hearing about. So please type topics that you are interested in discussing in the Facebook chat or by texting 313-822-2082. And before we go, I'd like all of our partners to turn on their videos. And we're doing this because it takes a lot of us to make this happen each week. And we are so grateful, not only for our panelists, but all of the community organizations that are making this work. And so everybody's up. Together, everyone say with me, stay healthy, stay powerful, and stay strong.
Manténganse saludables, manténganse poderosos.
Everyone be blessed.
Y que sean bendecidos. Gracias.
Good afternoon.
Bye-bye.
Thank you. Oh my God.
Ah, we did it again, team.